Alrighty. So this one is actually A. So group polarization is pretty much as the definition on the screen is that sharing our opinions with like-minded groups or like-minded people tend to strengthen our views. So if someone were to join the Republican club, that means they're joining a club that has other people with their same political views. So therefore, because they're all a part of this club, that means their opinions are just going to like manifest more to favor that one political party. So, however, groupthink, which a lot of you guys did put, is the enhancement of a group's fulfilling inclination through discussion with the group. So these two things are very similar in a way. Um, but yeah, I would definitely make sure you know the difference between the two. So moving on. Yeah, you guys killed it. This is D, but in the door phenomenon. The other things, I don't think I need to go over because you guys all got it right. Yeah, you guys are killing it. It's C. So yeah, if there's more people around, the less likely someone is willing to give help. So just being consciously aware of that can also prevent that from happening. So just a little tip for the future. Alrighty, so this is actually A. So these type of goals are shared goals that can only be achieved through cooperation. So having two conflicting groups work together on a similar goal can create them to cooperate and overcome their differences because they're trying to achieve that one goal. There's actually a really interesting study in your textbook about this with like a camp with young men having like to compete with each other in two separate groups, but at the end they were able to like work together to like achieve one goal despite like a lot of like not even big differences, just that the fact they were in two separate groups was enough to make have an us versus them mentality. But because they had that one goal near the end, they were able to overcome those differences and achieve what they needed to do. So I saw a lot of C's. So the social responsibility norms are an expectation that people will help those needing their help. So unfortunately, it's not C. So just think of norms. Those are rules that we follow as a society. So having a social responsibility to the other people around you is like a norm we must follow. And then I think I saw D as well. And the social exchange theory is just the theory that our social behavior is an exchange process where we try to maximize the benefits and minimize the costs of those like actions. So it's kind of like a give and take and just trying to make sure that you get the most out of something without like damage done to you, especially in like a social setting. So yeah. But good job, guys. You guys are killing it.
Okay, so yes, this one is B, the frustration aggression principle. That's the principle that frustration, the blocking of an attempt to achieve some goal, will create anger, which can then generate aggression. I did see one C, the scapegoat theory. That one is the theory that prejudice offers an outlet for anger by providing someone to blame for it. But yeah, good job, guys. Oh, Maddie, could you go to the next one? Yes, you're all correct. It is in-group refers to us, while out-group refers to them. I don't even think I need to, I just tried to throw you guys off. Good job. Yes, you're all right again. This one is false. So yeah, passionate love usually takes place at the beginning of a relationship, which is when it's the like intense absorption of one another. Kind of like what people call the honeymoon phase. So good job. You guys are all killing it right now. You're all right again. It is informational social influence. So that is the influence that results from a person's willingness to accept others' opinions about reality and how they see the world. So I don't even think I need to explain the other ones, but feel free to put it in the chat if you need anything else explained. Oh yeah. Okay, so the just world phenomenon is the tendency for people to believe that the world is just and that people therefore get what they deserve and deserve what they get, if that makes sense. The mere exposure effect is the tendency for repeated exposure to new stimuli to increase our liking of them. So like maybe like the first time that you saw a Stanley Cup, you thought that it was really ugly and you hated it. But then the more that you were exposed to them and the more of your friends that had them, you realize that you actually like it over time. Okay, yes. Good job, guys. It is cognitive dissonance theory. So that's the theory that we act to reduce the discomfort, which is also known as dissonance, that we feel when two of our thoughts are inconsistent with each other. So an example that I like to use is if you're being paid to write an essay about something that you might not really agree with. So say like the tuition increase at JMU, and you feel responsible for the words that you're writing, which are inconsistent with your attitudes. Like maybe you don't actually think that it's right to increase the tuition, but because you're writing about it, your thoughts and your actions are you two they're just kind of inconsistent with one another. Like you don't actually like the increase in tuition, but you have to write it because you're being paid to do it.
Also, just a disclaimer, in my notes, I accidentally put group polarization's definition for groupthink. So groupthink is actually the mode of thinking that occurs when the desire for harmony in a decision-making group overrides a realistic appraisals of alternatives. So it's just pretty much keeping the peace. So I'm sorry about that. And if you guys again have any questions about chapter 12, feel free to unmute yourself or type them in the chat. So.
Yeah, that's correct. It is reinforcement. So, kind of like in the teaching model, in like classical conditioning, or sorry, operant conditioning, when you're fearing something, a reinforcement is used for that. Yep. Yeah, the answer is C again, or C this time. Conditioned fears, like previously talking about the learning perspective. For example, there is an experiment where a baby was conditioned to fear a white rat, and that in the presence of the rat, it exhibited fear, and that was because of conditioned responses and because classical conditioning. So, yep, and that baby grew a phobia of the rat. So, there's the next step for that one. Yeah, so the answer is B. Good job, everyone. It is delusions. So it is talking about positive symptoms of schizophrenia. So positive means an addition of something. So it's an addition of something that's not normally in like a regular mental capacity. So since delusions don't regularly occur in humans, it's a positive symptom. And so negative symptoms of schizophrenia would have to do with flat emotion and catatonia. because it's taking away the presence of like regular emotion and feeling. So yeah, good job. Yeah, so it's not A, I'll give you that one, because people with bulimia continue to want to lose weight even when they're underweight. Kind of has to do with like anorexia, with like the it's like this like mental focus of like, oh, I don't like my self-perception, so I want to lose more weight, even though they are clinically underweight. And so the correct answer for this one is B. Bulimia is marked by weight fluctuations within or above normal ranges. And this is because bulimia basically is like binge eating. So, and a good example, I believe, is Queen Princess Diana herself. She had bulimia nervosa, where they kind of don't eat a lot, and when they eat, they a lot of high caloric foods in one sitting, and then quickly after they purge that food by throwing up or yeah. So that's why it's like fluctuation. So like they kind of eat, but then it's like so much, but then it's like so little. And yeah, so bulimia, um, different between gender differences. And D is not right because it's talking about fraternal rather than identical twins. All right, so this one was tricky. It's talking about intellectual disability. And the correct answer for this one is C. People with this condition have an intelligence score of about 70 or below. So these are people who just score lower on kind of like IQ tests and like intelligence scales. So yeah, this one is open. You can say whatever you want in the chat. And yeah. So I can just talk about this. So some of the values that come with like labeling individuals with disorders, like using the DSM-5, is that scientists use labels to communicate in like a common language. And like it's easier to diagnose if they're all talking the same language. And also kind of has to do with like this group feeling that clients don't feel lonely because there's someone to talk to who has that condition. Like if someone were diagnosed with depression, they'll say, oh yeah, I have depression too. So like you're not alone. And that creates like a sense of hope. But some dangers that involve labeling disorders can do with like overly broad like classifications of the disorder because yeah, it could help. Yeah, yeah, like kind of like stigmas are dangers too. And so it's not it's good to classify, but not to be super broad because that could put that client down. And another thing is that it could trigger assumptions that could change someone's behavior towards that imagery. So like if they were clinically diagnosed depression, then they're not going to help themselves with that. Say, oh, I have depression, so I should just stay in this like negative spiral that I'm in. So yeah, that's some dangers and some value to labeling disorders. Yeah, the answer is major depressive disorder because this is found worldwide. It's not gonna have that like cultural connection that like other disorders have. So major depressive disorder and schizophrenia are commonly found worldwide. That's a good question. I would say from the textbook, it talked about major depressive disorder being like just found really commonly, and it's a more commonly diagnosed disorder than bipolar, even though bipolar does kind of go hand in hand with major depressive disorder, where bipolar is like mania, then depression and mania, but a lot of the time it's just depression. Yep. Yeah, this one was a tricky question. So it's actually D, which, yeah. So symptoms of phobias appear around age 10, while symptoms of major depressive disorder tend to appear late around age 25. And yeah, that kind of has to do with like phobias is like kind of like childhood, like traumatizing events or ACEs, which are adolescent childhood experiences. I believe that's not the right, but something to do with like childhood experiences. So that's why it would be like a younger age audience or get diagnosed with symptoms of phobias, while later in life you probably will get become diagnosed with major depressive disorder because you go through many life events that will trigger traumatizing moments where you become depressed. So yeah. Yeah, this is the classical case of OCD or compulsive disorder, where there is an obsession and then a compulsion. So an obsession is a thought that ruminates where you cannot stop thinking about it and it kind of builds anxiety. And the only way to reduce that anxiety is to perform an action or a compulsion. So Marina decides that her compulsion is to clean the entire house because her anxiety is the house not being clean. Yeah, good job, everyone. So this is learned helplessness, this like self-defeating feeling, this like sinking feeling that whatever you do will not help the situation. And so, yeah, that has to do a lot like learning psychology. And I believe Pavlov also did research on learned helplessness, like when the dogs weren't able to get the food, they kind of just felt trapped in this like self-defeating belief. So yeah, good job.
Good job, guys. You all seem to be getting it right. So this one is going to be C. A, psychodynamy, just so you guys don't get confused, that is a made-up name. It is made up from psychodynamics, but psychodynamy is not a type of therapy. But psychoanalysis is going to be the type of therapy that like Freud focused on and dove into the patient's dreams, the meanings of that, the manifestations of that, and how the emotions were shared onto other people. Good job. This is also B. So this one is going to be aversive conditioning. A, B, and C and are all types of like counter conditioning, in which case a therapist is trying to recondition their client to not like something in A, B, and C, and to like doing something more in D. D is linked with reinforcement rather than punishment, which is a drug that would enhance nausea. That's punishment. Good. So this one is going to be D. Think you all get it. Cognitive is going to be changing how the patient thinks, behavioral, how the patient acts. Good job. This one is C. I want you all to pay attention to A, B, and D though, because those are all pros of group therapy, reasons why people might choose that over personal therapy. So just pay attention to that when studying. Okay, trick question, ha 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 ha. For the four of you that answered, thank you, brave souls, for trying and guessing. Technically, in your own way, you can be correct. therapy literally depends on what a person is going for. It depends on each person. It depends on the type of therapist. It depends on so many different factors. So it literally, there is no best type of therapy. It depends on so many different things.
Okay, before we start part 2 of chapter 15, just know that your code word is finals. So just keep that in mind because you'll need it later. And that's all I'm going to say about that. And this one doesn't have answer choices. So this one's kind of open-ended, but there is only one answer. Yes, so the answer is antidepressants, which are also called SSRIs. So yes, you're correct. All right, good job. Psychiatrists are the only ones who are allowed to prescribe and administer drugs. Psychologists and clinical psychologists are almost the same and they don't prescribe anything. You have to go to a psychiatrist who's actually a medical doctor who can prescribe those. This one is also open-ended. So if you don't want to write it all out in the chat, you can turn your mic on and explain it, but if not, that's fine. Awesome, you guys are correct. So it blocks the reuptake of serotonin between the presynaptic and postsynaptic neuron, and that helps the serotonin flow through the brain more freely than if it's getting used up over and over again. Yeah, so you're correct. There are many answers you could have given for this one. Electroconvulsive therapy is one. There's also mild cranial electrical stimulation, magnetic stimulation, and deep brain stimulation. I don't think you guys will have to know the specifics of them and why they're all different, but just being familiar with them is probably helpful. And in general, all of them are used to treat depressive disorders when someone is unresponsive to drugs. All right, I'll go ahead and explain this one. So psychosurgery is used for severe disorders in the brain that require surgery to destroy certain brain tissue. One example that you guys are probably familiar with is a lobotomy, which obviously aren't really used anymore. but you can have other ones like having part of your temporal lobe taken out to treat epilepsy is really common. And I think they're becoming more common as technology is getting better and stuff like that.
All right, that's all the questions we have for y'all. So if you go want to stay around to ask any questions for us, you're more than welcome to. We also sent out a study guide tips sheet and the TA discussion board. So take a look at that if you want any study tips. And yeah, and please fill out the form that Chloe just sent into the chat. But yeah, good luck on your exam tomorrow or on Friday.
Good luck.
Good
We
luck,
love you
everyone.
all.
Hey, y'all, just one question. I know you explained it initially, but what was the difference between groupthink and group polarization again?
Okay, hi. Yeah, I accidentally put in the definition for like the wrong one. But group polarization is pretty much when there's an enhancement of a group's prevailing inclinations through discussion within the group. So I mentioned the individual joining the Republican Club. They already have that ideology. Oh my God, it's been a long day. I'm so sorry. Also, hi, Marcus.
Also, hi.
I didn't know you were in this class. Sorry.
I saw TA Maddie Rover's Zoom call, please.
But so if you join a group or a club that's already have the same ideas as you, that just means your like ideas are just gonna keep manifesting because everyone else has the same idea. So it's that polarization just to one end. And then groupthink is just the mode of thinking that occurs when the desire for harmony in the decision-making group overrides a realistic appraisals of alternatives. So I'm trying to find, there was like, and then page 410 is where you can find the like definitions and more examples and stuff. But a great example of groupthink is the US Space Shuttle Challenger explosion. They did see a lot of faults in the like rocket, but because everyone was kind of like, oh, like we had to like get this like done because it's going to be on TV, like it'll be fine. No one really like said we should not send these people up into space, even though there was like calculation failures and stuff. But because of that group thing, unfortunately, the rocket ship did explode. So
I would say the Zoom call is also another great example of groupthink because you put a question or answer into the chat and then someone's like, oh yeah, I think it's B as well, but it's like not actually B. And so like it influences your own opinion too. So
I
yeah.
love Stray a few times doing exactly that.
yeah.
Thank y'all.
You're welcome.
Appreciate
Good
it.
luck.